talk about health promotion practice, what that means, why it's indicated, and what the implications might be. Health has come to mean many things, but you have to distinguish between health and illness. The World Health Organization has defined health as a complete state of physical, social, and emotional well-being. In addition, the Ottawa Charter has talked about health being the greatest resource that we have in life. Think about it, the greatest resource that we have in our lives. Health will give us not only years to our life, but will add life to those years. Since World War II, we have had an abundance of wealth in the high-income countries, or has led to many countries being high income. After the war, we started to eat far more fat, far more sugar, far more meat, and far more salt than our bodies were really designed to eat. As a result, we now have unprecedented rates of heart disease, hypertension and stroke, type 2 diabetes, obesity, and cancers. These are now the leading cause of death in the high-income countries. I travel around the world a great deal and have had the privilege of going to many low and middle-income countries. And what I'm observing, and has been well documented by the World Health Organization and by many other national bodies, is that with economic development and growth, we are now seeing these patterns of increased abundance and movement away from traditional diets and inactivity, and in some countries, increasing rates of smoking, even though smoking has been decreasing in high-income countries. So we're beginning to see another wave of these lifestyle-related conditions, and I do want to be very clear that these are lifestyle-related. People can have tremendously healthy lifestyles and still succumb to heart disease or cancer. So by no means is it necessarily causative. But the evidence is abundantly clear that there are very strong causative links to our lifestyles and these conditions. Well, comes one of how do we actually promote health? And not only promote health, but how do we do it within the context of a healthcare system? We have governments that tell us we shouldn't smoke and that we should eat better and exercise more. However, that's not the end of the picture. We need to have these concepts introduced into our daily lives in a way that it's promoted by healthcare professionals. We have had a healthcare system where we have physicians and surgeons who are highly trained to administer medications and to prescribe them in an evidence-based way. We're talking a lot these days about evidence-based practice, and that is that there is scientific research to support the prescription of those medications or the administration of a surgery. However, we also have to realize the power of healthy living and that the importance of prescribing physical activity, of prescribing good nutrition for everyone. So you can have a chronic disease or multiple, as we now know that you can have many superimposed chronic lifestyle-related conditions because they're often all related by an underlying cause, which may be, or contributing factors are lifestyles, and that you can still enjoy a very high measure of health. So we do have to think about these challenges and that we have to make some radically big changes. That just doing a few changes here and there in our healthcare system is inadequate. We have to reconfigure, reconstruct how we actually assess patients, their health and their illness, and how we put these two together in terms of implications for their long-term care. Think about how we're educated as healthcare providers. we have to think about how we have come from what we call the biomedical model, which was particularly useful during the era of infectious disease, where you had an infectious microorganism and we had a medication to address it. That model is failing to address the problems and the priorities that we have today. And that's for a number of reasons. One is that these are complex conditions, they have multiple side effects. The medications that people take for these conditions also have side effects. So by getting the focus on the health of the person, there's a great deal of literature to support that you may not need to take medication at all. Or if you do, the potency or the strength of that medication could be reduced, as well as the amount of time or the number of dosages that you take. So as we get the health piece right, we need to work closely with physicians to ensure that if medication changes are needed, if we need to remove them, that can be done, or if they need to be reduced. So it's a very close link between the health promotion side and the invasive care side, the drug side. With respect to surgery, we know that people, by getting the diet, perhaps losing weight, being more fit, that in fact some surgeries are no longer indicated at all, or perhaps less invasive surgery would be needed. So with this kind of model, we are alleviating the load on doctors and surgeries and the need for drugs considerably, and that we will be putting our physician surgeons to better use. There's what we call interprofessional care and interprofessional practice. And it really comes from the need for us to, as healthcare providers, to no longer work individually and alongside each other. We really have to work together. We have to assess patients together or share our assessments. We have to decide to what degree do we use the non-invasive approaches related to healthy living, that is not smoking, good nutrition, and adequate physical exercise. How can we do this, and as that is taking place, to start determining whether drugs are needed or not, or if they are, to help reduce the need for those medications or potentially surgery over the long run. It's going to take a change of attitude. It's going to change the way in which we educate our healthcare providers very early on. So we need to have, right from the beginning, socialized to think of working together. I would also like to say that patients need to see this reflected. They need to see that